and good afternoon everyone. So today I would like to introduce our topic, which is the effect of exercise on diabetes. Alright, so first thing first, we should know what is a diabetes. So diabetes is a chronic disease that occurs when the body cannot produce enough insulin or cannot use insulin properly. Okay, as a result, blood as a result, blood sugar in our body can blood sugar in our body becomes too high. Okay. Diabetes that have two main types. Okay, type 1 diabetes occurs when body produces little or no insulin, and type 2 diabetes occurs when the body can use insulin effectively. And diabetes can affect millions of people worldwide, and can cause serious health complications if not managed well. Okay, therefore, understanding diabetes is important. Before we discuss how um, we discuss how we discuss Therefore, understanding diabetes is important before we discuss how exercise can manage this condition.
Hi, good afternoon. My name is Muhammad. My name is Muhammad Haikal. Mention number S79945. Today I want to explain about the factor of diabetes, which is have two categories. The first one is modifiable factor, or we call it a lifestyle factor, and the second one is non-modifiable factor, or we call natural factor. Okay, for the lifestyle factor, you can change by yourself. It depends on your lifestyle. Meaning that it depends on your exercise or nutrition or what you taken. And the second factor is a natural factor, which is the factor you cannot change. It is very different with another one, which is the first factor. But you guys don't need to worry because the problem you can prevent depends on your lifestyle also lah. And then I want to explain more detail about the lifestyle factor. I've taken three factors, which is the first one is lack of exercise. If you are one of the person who not do exercise, the chance to got diabetes are very high lah, because you not enough physical activity. It depends on you what exercise you want to do lah. You can running, walking, and also jogging lah. It depends on yourself lah. And then the second one is unhealthy diet. One of the reason the patient who have a diabetes because they not manage their nutrition. To prevent this happen, you must to eat healthy food lah. For example, you eat a vegetable and drink also the plain water properly. And then the last one is being overweight. Too much fat is very dangerous because the fat it can block the insulin on your body. The insulin cannot work properly, and then cannot open your body cells to let sugar in it. Sugar can trap in your body blood and causes diabetes. For the next is I want to explain about natural factor. I've taken three also. The first one is family history. If our parents have a diabetes, it means we have a higher risk to got the diabetes also because of our DNA. But we can prevent it. We can avoid to got diabetes by your lifestyle, by your taken nutrition properly. And then the second one is getting older. When you get older, especially when you're 45 years old above, you easily to got diabetes because your organ do not work perfect as before lah. And the last one is a race or ethnicity. In Malaysia, statistics show we have a lot diabetes in our country because we cannot manage our nutrition or exercise properly lah. That's all for me.
Okay, now let's move to effects of diabetes on our body. The first one is diabetes can affect our heart and blood vessel. High blood sugar that contained in our body can damage the wall of blood vessel that can cause our poor blood circulation. This increases the risk of a serious health problem such as high blood pressure, stroke, heart disease, and heart attack. Secondly, diabetes can also affect our eyes. High blood sugar can damage the small blood vessel in our retina, which is the part of the eye that is responsible for our vision. This condition is called diabetic retinopathy. If it becomes worse, it can cause blurred vision and may lead to permanent vision problem. Besides that, diabetes can also affect our kidney. The kidney work to filter waste and extra fluid from the blood. However, high blood sugar level can damage our kidney over time and make them unable to function properly. In severe cases, it can lead to kidney failure.
Next, effect of exercise on diabetes. One major effect of exercise is that is lower blood sugar level. During physical activity, muscle use glucose as a source of energy, which is reduced the amount of sugar in the bloodstream. This helps people with diabetes maintain better blood glucose control. Next, exercise helps with control weight. Maintaining a healthy body weight can reduce the risk of developing diabetes and improve blood sugar control in individuals who already have the condition. Lastly, exercise contributes to improve mental health by reducing stress, anxiety, and depression. A positive mental state can help individuals stay motivated to manage their diabetes effectively.
Yes. Assalamualaikum. My name is Muhammad Haikal and my mention number is S79302. And today I want to explain the best type of exercises that can be practiced by diabetes patients. So the first kind of exercise that can be practiced is jogging. Jogging, as we all know, is the most effective kind of exercise, which is it can be do at any time, also at anywhere, and there are many kind of benefit about it, which is it can help to lower blood sugar level, improve insulin sensitivity, also burn calories and body fat. So secondly is cycling. Cycling is not too kind of different compared with the jogging, and it also have many benefit about it, such as it can burn calories effectively, improve cardiovascular fitness, also improve circulation and heart health. Okay, number 3 is yoga. Yoga is I'm quite surprised because this kind of exercises can it can reduce our sugar level into our body, and from yoga itself, it can reduce our stress hormone. It can improve balance and mobility. Also, it can help to stabilize our blood sugar. And lastly is swimming. Swimming, as we all know, is the most kind of exercise that consists our all part of body is involved, which is our movement from the hand, also for our feet. And by swimming, it can help in terms of our weight management, which we are practicing it. Secondly, it can improve our blood circulation, and lastly, it can also swimming is suitable for the adults in order for them to reduce their sugar level in their blood. So this all from me.
Hello, my name is Muhammad Abdul. To wrap things up, regular exercise is a key factor in both preventing and managing diabetes. It improves insulin sensitivity, lower blood sugar level, helps control weight, and enhance mental health by reducing the risk of complications such as heart disease and obesity. Exercise support overall well-being and empower individuals to live healthier lives. So, dapat kita tengok exercise ni sangat penting walaupun kita walaupun kita sihat, tak ada diabetes, lebih baik kita mencegah lebih baik daripada mengubati. So macam kita tengok baru-baru ini satu je ada lelaki satu lagi patah time hiking. Dia macam pelakar tapi dia sebab exercise boleh elakkan kita daripada berlaku benda macam ni lah. So satu langkah ke gaya hidup sihat lebih baik daripada menyesal ke di hari kemudian. Terima kasih.
Thank you for the presentation. Questions for them? From the class, do you have a question for them? No question? Sure. Okay. For people with diabetes, how much exercise do you think is most effective? Is it very high, moderate, or low? Which one do you think is more effective for them to do?
I think for my opinion, I think it's based on situation. If you want to for a short term of period, high intensity of exercise is very suitable, is very appropriate, such as do a running or jogging. And but as we all know, diabetes is not for 40, 30 years old. It can be 70 years old, 18, and for them it's very hard, it's very tough for them to those of exercise. And I think like I said, we can do like maybe brisk walk for a consistent for a long time. It can reduce the diabetes on the body.
Do you agree or you have another opinion?
We agree.
All agree. Macam itulah. Okay, thank you very much. Let's